It's open enrollment, so let's discuss some important changes and take a look at those 2023 plans. Hi there. As always, if you have any questions whatsoever, please feel free to send us a message or give us a call at the number on the screen. And as always, please make sure to subscribe to stay up to date. And of course, make sure to click that thumbs up button, give us a like so that we can get this information out there. So today we're going to be talking about those 2023 plans for marketplace insurance. But before we dive into that, let's go over the basics of marketplace insurance for those who maybe haven't had it in the past, and as a refresher for those who have had marketplace insurance in years past. Now, under the ACA, which is the Affordable Care Act, a marketplace plan cannot charge you more or deny you based on a pre-existing condition. Additionally, all marketplace plans must offer at least the 10 essential benefits. And these 10 essential benefits can of course be found on healthcare.gov. Ambulatory patient services, emergency services, hospitalization, pregnancy, as well as maternity and newborn care, mental health and substance use disorders, prescription drugs, rehabilitative services and habilitative services and devices, laboratory services, preventative and wellness services and chronic disease management, and pediatric services. Additionally, plans must offer birth control coverage and breastfeeding coverage. And of course, plans do often offer additional benefits, but these are the 10 essential benefits as listed on healthcare.gov. And of course, if you so choose, you can also purchase dental and vision insurance. Now, the next thing I want to talk about is those metal tiers. You may or may not have heard of these. It is the bronze, silver, gold, and platinum metal tier plans. Now, these names have nothing to do with the quality of the plan. It has nothing to do with the benefits offered or the network size or anything like that. It only indicates the cost-sharing structure. So that is to say, the coinsurance. Now, if you're unfamiliar with the term coinsurance, basically it is a percentage of the service rendered that your health insurance carrier will cover, and then you're responsible for the remaining percentage. So for a bronze level plan, your health insurance carrier will pay 60%, you pay 40%. For silver, it is a 70-30 split. For gold, it's an 80-20, and for platinum, it is a 90-10. Two more important things to note. If you are eligible for premium tax credits, which we're going to cover in just a minute, you may notice that it says that you may be eligible for additional savings if you choose a silver plan. Also, since we're talking about that cost sharing, you may also notice that bronze level plans tend to have lower monthly premiums and platinum plans tend to have higher monthly premiums, and that is directly related to the cost sharing structure. You'll also be able to choose between HMOs, EPOs, and possibly PPOs, although PPO coverage is pretty rare on the marketplace. So an HMO, generally speaking, will have lower monthly premiums. However, you will have to have a PCP, which is a primary care physician, to provide referrals for specialists, and you will only get coverage in network. A PPO, on the other hand, generally speaking, will have higher monthly premiums, but you don't have to have a primary care physician, you don't need referrals for specialists, and you will have coverage in and out of network. And then there are EPOs, which are somewhere in between. You don't have to have a PCP and you don't need referrals, but you will only have coverage in network. Now let's talk about some changes coming in 2023. Namely, I want to talk about those premium tax credits. So, under the American Rescue Plan Act, the eligibility for premium tax credits was expanded, as was the size of those premium tax credits themselves. Now, these were set to expire at the end of this year. However, under the Inflation Reduction Act, the expanded and extended premium tax credits have been extended through 2025. So when you enroll in a marketplace plan, you may be eligible for a premium tax credit. This is determined by your income and your household size. Basically, it is just a tax credit that's paid up front as opposed to when you pay your taxes or receive a refund. And of course, this is reflected in a discounted monthly premium. Now, in the past, those who made more than 400% of the FPL, which is the federal poverty level, were ineligible for a premium tax credit. Now, the subsidy cliff was a term used to describe those who basically fell abruptly off the precipice of eligibility for a subsidy. So a single person who made more than $51,520 would be ineligible and might in fact fall prey to the subsidy cliff. The American Rescue Plan and thus the Inflation Reduction Act have actually smoothed out the subsidy cliff, so more Americans are eligible for premium tax credits than in years past. Actually, many people have been able to access a plan for $10 or less per month. So if you've had marketplace insurance in the past, you can expect that your premiums will be largely unchanged now that the Inflation Reduction Act has extended those expanded premium tax credits. So now let's dive in and take a look at the plans. So if you're unsure whether your state uses healthcare.gov or an individual state marketplace, healthcare.gov will actually redirect you. So I'm going to put in a zip code for New York, which actually does not use healthcare.gov. And then you'll see your state's marketplace is New York State of Health. Visit, and then this is a clickable link, and it would redirect you towards your individual state's marketplace. Now, if I were to use a Florida zip code, which uses healthcare.gov, then it would let me see the plans and prices on healthcare.gov. It's going to ask you a few questions to determine your eligibility for premium tax credits. Now, of course, you can choose to skip this if you'd like, and you'll see the full price plans, but let's take a few minutes to just look at some of these options. So we're going to skip this current plan ID. Now, if it's just you or you and other people, again, you can skip, but not really recommended. So let's do you and other people. So let's see. Answer yes if legally married, no if divorced, separated, unmarried, living together, or widowed. So let's say no. So if you have any dependents, don't count yourself or your spouse as a dependent. So we said it is going to be you and other people, so we'll say yes. How many people? Let's say 2. So let's tell us about you. Let's say a 35-year-old man. We're not going to put eligible for health coverage through a job, Medicare, Medicaid, or CHIP. We did say that we were claiming somebody as a tax dependent, not pregnant, not a tobacco user. And then we will click next. Dependent 1. Let's say dependent 1 is 5. And none of these apply, so we're going to continue. And let's say dependent 2 is 3. None of these apply, so we'll continue. Then it asks you to confirm your household members. So we said we're a 35-year-old man who is a legal parent or guardian of children under 19, and here are the 2 dependents that we added. Now it's going to ask to estimate your income. So let's say that it is $55,000 per year. Continue. Based on the income and household information you provided, your household may qualify for an estimated premium tax credit of $808 per month. This is an estimate. So that means you'll see a discount reflected on your monthly premium of about $808 per month. Again, an estimate. You'll also see here that you may be eligible for extra savings if you pick a silver plan. We did mention that earlier in the video. So let's view plans. So it's going to show you quick definitions. You can filter and select plans to compare, which we're going to do in just a moment. Here's also what I mentioned earlier, the bronze, silver, gold, and platinum. And again, you notice the bronze average premium significantly lower than the platinum average monthly premium. That is because you pay more when you get care. Your deductible is very low, and your plan pays nearly all of your health care costs. And then these plans are, of course, somewhere in between. So this one is lower on a monthly basis, but when you utilize your services, you'll pay more. This one is more expensive on a monthly basis, but when you utilize your services, you will pay less. And now it's offering you all of the plans available. So this one is showing us 224 plans available. Currently it is sorting by lowest monthly premium, but of course you can also sort by lowest deductible. There's also an inverse relationship, generally speaking, with deductibles and premiums. So if I'm picking a plan with a lower monthly premium, usually it may have a slightly higher deductible. If I'm picking a plan with a lower deductible, generally speaking, it will have a higher monthly premium. Let's go back to the monthly premiums. Okay, so let's take you through exactly what highlights you're going to look for. So here is your monthly premium, the amount that you pay on a monthly basis to keep your insurance active. And here is your deductible. This is the amount that you have to pay out of pocket before your insurance begins to contribute to the cost share. Now, this is a bronze plan. So in that case, your insurance carrier would pay 60% and you would pay 40%. However, there are often many services that are covered even prior to meeting the deductible. Generally speaking, these are basic services like wellness visits. Here are some more important information. This is your out-of-pocket maximum. So, should you incur medical expenses, not including your monthly premium, that come to a total of $18,200, that's it for the year. Your insurance carrier will take over the rest of the medical bills. Now, this is to protect you from major medical debt. This is not really what is expected. This is not your expected yearly cost, but it is to protect you in case you should have major medical bills and if you're in need of major medical procedures or care. Here are some other important costs. Emergency room care is a 50% coinsurance after you've met your deductible. Generic drugs, $35 copay after deductible. No charge for a primary care doctor and no charge for a specialist. Now, what you would want to do is see if your medical providers accept this plan. That's very important. If you know the doctor that you like to visit, if there are specialists or hospitals that you plan to utilize or just want to have as an option, you want to see if they are in network. The same with prescription drugs. If you take any prescription drugs, you'd like to see if they're covered and at what cost. You can also look over here at the plan details, and we will get to that in just a minute. Now let's look at some other plans. So this one also has a $0 monthly premium, a $15,000 deductible, and an $18,000 out-of-pocket maximum. Again, you would want to check with your doctors and hospitals and prescription drugs. 50% coinsurance after deductible, $25 generic drugs. It doesn't indicate that you have to meet the deductible first, $50 to visit your primary, and $100 to visit your specialist. Now, since we're going by premiums, some of these numbers may seem a little bit similar. However, the benefits provided and the networks could vary quite greatly. So let's scroll up here, and I want to compare these to lowest deductible. So you'll see here, so this plan you have to pay $383.10 on a monthly basis to keep your insurance active. However, the deductible is $0, so your insurance will immediately begin to contribute to the cost share. And your out-of-pocket maximum is $10,000. Your coinsurance is 30%, generic drugs $14, primary care doctor $5, and a specialist $60. This plan offers dental. This plan has pretty low price generic drugs. This plan has a pretty low out-of-pocket maximum. So this plan might be for somebody that has significant medical needs because yes, you are going to be paying a lot on a monthly basis. But once you've hit $4,000 in medical bills, not including your monthly premium, your insurance carrier would take over the remainder of your medical bills. So very often, people that have higher medical needs, and you'll see here this is a platinum plan, very often people that have higher medical needs may be better served with a plan that has perhaps a higher monthly premium with a lower out-of-pocket maximum, a lower deductible, and very often those platinum plans will be better served for people that have more extensive medical needs. Now let's scroll back up, and I'd like you to look at the filters here, because sometimes there are things that you know are very important to you, and you really want to weed out the plans that aren't going to offer you what you're looking for. So first and foremost, very easy to determine exactly what your monthly budget is. If you know you cannot spend more than $500 monthly on your health insurance. And you'll see here that there are EPOs and HMOs. So let's say that the thought of having to go through your PCP to get a referral is just something that you cannot tolerate. Well, then you want to go with an EPO. So let's apply those filters and see what happens. Well, we've cut our available plans down by about half. Let's go back to filtering, rather sorting by lowest monthly premium. Okay, so this plan is an EPO. So that means no PCP, no referrals, but you do have to stay in network to have coverage. $0 monthly premium, $15,500 deductible, and an $18,200 out-of-pocket maximum. So now what I would like to do is compare a couple of these plans. So let's pick some that seem pretty different. Let's pick this one here. We'll compare this one. Let's pick, let's see. Let's pick this plan. 11 pages. And let's pick this one. We're going to compare 3 plans. So I did pick 3 bronze plans, but you would notice it's different if you picked a silver, a gold, or a platinum. So first it's going to compare our monthly premiums, $0, $29.69, and $72.85. Here it's comparing the deductibles. This is $7,750 for individual, $15,500 for family. So the difference between an individual and a family deductible, it basically works the same way for your out-of-pocket maximums as well. This is designed to help you save money. So as an individual, as you're spending towards your deductible, your health insurance plan is keeping track of that. And once you have met that $7,750, your insurance will begin to contribute to the cost share. But there are other members of your family as well. And just because you've met your deductible doesn't mean they've met theirs. So their plan would basically not contribute to their cost share. However, as you are all spending on your medical needs, if combined you reach $15,500, then you will all be covered. So even if only 2 people basically met their individual deductible, the entire family would now have the cost share as opposed to having to pay for everything out of pocket. And it works the same way with the out-of-pocket maximum. These are all EPOs. Here we could check if we had medical providers, we would see which ones were in network and which ones weren't. You'll also see here the star rating. Plan documents. These are very, very lengthy and very, very complicated. This is why we always recommend working with a broker, even if it's not us, somebody to help walk you through the summary of benefits and make sure that you really understand what is covered by your plan. Costs for medical care. Okay, so this is just going to give you some basic ideas of what things might cost. Now, this plan is eligible for an HSA, which is a health savings account. And that's because this plan is considered a high deductible health plan, and it does offer an HSA. Not all high deductible health plans offer HSAs. An HSA, like I said, is a health savings account. Basically, you can contribute up to a certain amount, whether you are an individual or a family, and that amount of money is pre-tax. So it will lower your taxable income. It will also lower your MAGI, which is what healthcare.gov uses to determine if you are eligible for a premium tax credit. Now, that health savings account is your money in an interest-bearing account. And as long as you use that money for a qualified medical expense, and the list is very, very long, as long as you use that money for a qualified medical expense, there is no tax on it. Now, you can choose not to touch that money also, and the interest accrued is not taxed, and you can even invest a certain portion of the money. And if you manage to hold on to that HSA until you're 65, you can withdraw the money and use it as you would a regular savings account. Let's move on to prescription drugs. So here you will see exactly what the cost might be. So for generic drugs, $3, $23, no charge after deductible. Here's preferred brand drugs, $250, no charge after deductible, no charge after deductible. This is definitely a pattern. 50% coinsurance after deductible, no charge, no charge. Specialty drugs, 50% coinsurance, no charge, no charge. Here's a list of covered drugs if you wanted to look through all of that. So your prescription drug deductible is included in your plan deductible. It is not a separate deductible. Here's access to hospitals and doctors. National Provider Network, no, because these are not PPOs. Need referral to see a specialist, no, because this is an EPO. This is what your hospital costs might be. And here, this is just to give you an idea of some basic healthcare costs. Adult dental coverage, it is not covered in either of these plans, but there is coverage in this secondary plan. Now do remember, you don't need to choose a plan based on whether it offers dental or vision. There are add-ons that you can choose, and of course there is private insurance for dental and vision, and it is much less expensive than you might think. It is especially much less expensive when compared to health insurance. And the added benefit to that is, like I said, it's very hard to find PPOs on marketplace plans. Obviously here, they weren't offered at all. But if you go the private dental insurance route, you can choose a PPO plan, which certainly opens up your opportunities much more than having to go with an HMO, or in this case, a DHMO, since we're talking about dental insurance. And then child dental coverage as well. Here's medical management programs if you wanted to learn more about whether those are offered with your plan, and any additional other services. So sometimes there are additional benefits that aren't necessarily offered by all plans, but might be offered by your plan. So right here you see something about easy pricing. So right here you'll see that these types of plans actually offer certain services with just a copayment before you've met your deductible. So you'll just be responsible for a copay as opposed to the entirety of the cost of the service. So some of these plans offer copays for doctors and specialist visits, urgent care, physical, speech, and occupational therapy, and prescription drugs. So these plans are sort of a happy medium. So if you are somebody that is insistent on doing it by yourself, if you don't want to work with a broker to help guide you, these plans can be a little bit easier to understand. That's not to say they are better plans, they're just easier to understand. So you'll see here's where it's annotated, this is an easy pricing plan. In most states, open enrollment is November 1st to January 15th. However, it can vary by state. So make sure to log on to healthcare.gov for more information, and if your state uses an individual marketplace, you'll be redirected at that point. Of course, if you have any questions whatsoever, please feel free to send us a message or give us a call, and we can not only assist with answering your questions, but also helping you to enroll in a marketplace plan if you so choose. And of course, please make sure to subscribe and click that like button to stay up to date. Thank you so much for watching. We wish you the best of luck in open enrollment this year, and have a wonderful day. Bye-bye.